to the APS Academic Channel. This is the Physiotherapy and Anatomy and Assessment series. My name is Oyinda Mola Hajewole, and we'll be talking about rotator cuff today. So, what is a rotator cuff? Rotator cuff is a group of four muscles that help to move and stabilize the shoulder, majorly to stabilize the shoulder when the shoulder is moving. And these four muscles are the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. Moving on next to the common injuries that affect the rotator cuff. There are majorly four of them, and these include rotator cuff tears, rotator cuff tendinitis, rotator cuff tendinopathy, and the impingement syndrome. Talking about rotator cuff tears, this includes both micro and macro tears of the rotator cuff muscles or the tendons. Then when it's tendinitis, it's like an inflammation of the tendon which the rotator cuff muscles attaches used for their attachment. Then tendinopathy, when there is massive chronic or degenerative condition affecting the tendons and soft tissues of the rotator cuff. Then impingement, this could include impingement of the muscles in the subacromial space due to frequent movement, so it gets impinged, and that can lead to a lot of pain and can eventually even lead to tears of the rotator cuff muscles. So these four, don't forget, tendinopathy, tendinitis, tear, and impingement. What actually is the risk factor for having rotator cuff tears or rotator cuff injuries? Firstly, it's age. I mean, as the body ages, a lot of structures in the body breaks down, and so that makes age a very major risk factor for rotator cuff injury. Then also, if you're into a sport or an occupation that requires you to frequently move your shoulder over your head, so a lot of overhead movement. Let's say you are a javelin thrower or you are a badminton player, so you always have to do this and like move your shoulder over your head. That, and then if you also have an occupation that requires you to do that a lot, that can also lead to a tear or an injury to the rotator cuff. Also, if there's a family history, like if it's a common occurrence in the family, usually the direct family, and you see like, okay, my uncle had the history of this, my brother had a history of this, my sister had a history of this, then you are at a risk factor for having rotator cuff tear. As a clinician or a clinical student, you're in the clinic and someone comes to you, how do you actually identify that they have a rotator cuff injury? There is that's what we call the clinical presentation for this condition. So a rotator cuff injury presents with painful movement of the shoulder in usually all planes, usually the shoulder abduction and shoulder internal rotation, because the muscles of the rotator cuff usually controls this movement. So the person will not be able to perform movements that requires them to bring their hands to their back, movements that require them to bring their hands to their hair for grooming, to dress up, to take care of their body and take care of their hair as well because of the shoulder impairment. Then also shoulder weakness. This person would not be able to carry out, they'll not be able to have full muscle strength in the shoulder because of this rotator cuff injuries. Let's talk about the diagnosis for rotator cuff injury. So how do you diagnose that this person actually has a rotator cuff injury? First is your history taking. So you ask for where is the location of the pain or the limitations. Where is it? Okay, usually location for pain. Then you ask when did the pain start? How did it start? What is the rate of the pain? Like how much is the pain? You can use the NPRS scale or the VAS scale to just know and ascertain the level of pain they have, the location, how it started, and all. Then you can also ask, like I said above, the family history. If there's a family history of frequent shoulder pain, and ask them if they frequently dislocate their shoulder, what occupation do they do, and what is the usual activities they have to do that they are limited in doing. You can ask all those questions. That would give you an idea of actually whether it's rotator cuff. And also visual inspection. So you visually look at the shoulder, look at it from the front, check for atrophy, look at it from the back, check if there is any scapular retraction or if there's just anything out of place. And you don't just check when they're static, you also check as they are moving it, so you know if there is any compensatory movements that they're trying to do with their shoulder movement. Then also you assess the muscle strength, so you grade their muscle strength. Usually muscle strength for shoulder abduction for internal rotation and external rotation, because you know that of course the supraspinatus that leads to 15 degree is for shoulder abduction. So you would measure that as well. Then you can also do some you can get laboratory investigations. The most sensitive one for a rotator cuff tear is the MRI. So the MRI is very sensitive to rotator cuff tears and injuries. You can also get an X-ray to know, okay, probably there's a fracture and it's not even rotator cuff injury. Then you can also do ROM, range of motion, to assess, okay, how much range of motion do they have in this joint? Are they apprehensive at any point? Are they scared of any particular movement and saying, oh, this is the particular movement that is causing me pain? So you check that as well. Then you can also palpate. You can palpate for any tenderness. So you palpate the particular muscles. So you can palpate the supraspinatus, you can palpate the infraspinatus, you can palpate the subscapularis, just to know, okay, where is the pain exactly located, and to know which particular muscles among the rotator cuff is affected. And you can do some special tests to ascertain. So there are four major let's say cluster of tests to ascertain rotator cuff injuries. And this includes the painful hack test, the NIAS test, the Hawkins Kennedy test, and the last but not the least, the empty can test. So how is the painful arm test done? So the painful arc test is done by, you ask the patient to keep their hands in neutral. So I will stand now to demonstrate that. So this is it. The patient's arm is by their side neutral. Then you ask them to go all the way up to 120 degrees. So if there is pain between 60 degrees to 120 degrees, then from 60 around here to 120 degrees, then that is a positive painful hack test. Then you can also ask them to do the Hawkins Kennedy test. So the Hawkins Kennedy test is done by, the arm is a 90-degree flexion, the elbow as well is a 90-degree flexion. Then you try to internally rotate. So like you as a therapist bring your hand and you try to internally rotate your arm. If there is pain, that is a positive Hawkins Kennedy test. Then the empty can test as well. So you ask the patient to flex their arm to 90 degrees, and you tell them to bring their you tell them to bring their thumb downwards, like point your thumb downwards, and then tell them, and then you provide a resistance. Then tell them to externally rotate against the resistance. That they tell them to bring their thumb upwards while you're offering a resistance. This will show, okay, how much of force they have for external rotation, and if there's pain as well, that is a positive sign. Then the last test is the nearest test. So you stand behind them, you stabilize their scapula with one of your hands, and then you move their shoulder all the way to, or you move the shoulder in shoulder flexion plane from 0 degree shoulder flexion to 180 degrees shoulder flexion, to ascertain if there is any compensatory movement and if there is pain as well. So these are the four special tests. Let me go over them again: the painful heart test, the MC can test, the NIRS test, and the Hawkins Kennedy test. Then talk about the treatment for rotator cuff injuries. There is a non-pharmacological of conservative treatment, and there is a pharmacological and surgical treatment. Talking about non-pharmacological, we're talking about, okay, we don't want to use drugs, and also we don't want to use surgery yet. So it's usually when there is maybe a micro tear, or it's just a sprain, or it's just weakness that is causing their pain and everything, that's causing the rotator cuff injury. So you note that. So if it is that, then this is where we as physiotherapists come in for conservative treatment of this person. So how do we treat them? First, we want to relieve their pain. So pain relief strategies, we can use cryotherapy, we can use hydrocollator pack depending on the level at which the pain is. So if it's acute, we can consider using cryotherapy. We can do ice massage, we can do ice pack and everything. Then also we help them to improve their range of motion after the pain has been relieved. They want to ensure that no contractures are being formed and there is no limitation in their range of motion. So we help to do range of motion exercises. Then we also strengthen the weak muscles, the muscles that are weak or lax. We strengthen them as well. Then we also help them with lifestyle and activity modifications. So if it's someone who works in an occupation where they have to do a lot of overhead movement, we advise them on how to do that effectively. So we teach them and help them to modify their lifestyles and everything. So thank you so much, and that is all about the rotator cuff injuries. Please let's have you share, like, and subscribe to our channel. It will be really nice to have you watch our next video and comment as well on what you think we should integrate in our next video. So see you, and this, like I said above, is the APS Academic Channel. Bye bye.